Hello, I'm Dr. Ecke. Today I like to take a few minutes to talk about ear health. Our ears are amazing structures. They don't just allow us to hear, they also play a major role in balance. When problems arise, they can affect everything from communication to enjoying music or even walking steadily. Let's start with one of the most common issues we see in an ENT office, which is usually earwax. Earwax is actually good for you. Nobody really knows, but it is. It protects and cleans the ear canal. Problems only occur if there is too much buildup of earwax or when people try cleaning their ears, and we all really like to do that, I know. We often like cotton swabs, aren't we? This often pushes the wax deeper, sometimes leading to pain, hearing loss, or even infections in the ear. If you feel blocked, it's better to let a hair health provider remove it safely rather trying it on your own. Another concern is ear infections. Children are especially more prone to them, but adults can get them too. Symptoms may include ear pain, fever, drainage, or even hearing changes. Most infections are easily treated, but repeated ones should be evaluated and not easily misinterpreted. Since they can affect long-term hearing, it's important to look after them. Hearing loss is another area I want to highlight. Hearing loss can be sudden, for example after viral infection or being exposed to loud noise, or gradually developing over years. Many people think hearing loss is just part of aging, but it really isn't. In many ways, we can help. Modern hearing aids, that means amplification, are discreet and effective little devices which may be beneficial for you. And for people with more severe hearing loss, cochlear implants, more advanced devices are life-changing. Another condition many patients mention is tinnitus. This is a ringing, buzzing, or humming in the ears, and sometimes signals underlying hearing loss, circulation issues, or exposure to loud sounds. There are treatments that can help managing it, even if we can't always eliminate it completely. And since we are here living in a tropical paradise, let's not forget to talk about swimmer's ears. Swimmer's ears is an outer ear canal infection caused by water trapped within the ear canal. This can happen when swimming, diving, or even after showers. The ear may feel painful, itchy, or swollen. Simply precautions like drying your ears well after you had a swim or you took a shower, or rinsing it with fresh water after swimming in the sea and using preventative drops can help. Finally, balance disorders like vertigo are also ear-related, and if you've ever had such a spinning dizziness, you know how disabling it can be. The inner ear's balance organ are often a cause here, and with the right diagnosis, effective treatment is available. There are a few key takeaways of today's video. Don't put objects into your ear. Get regular hearing checks, especially if you notice changes. Protect your ears from loud noise or water. Seek help early for pain, ringing, and dizziness. Healthy ears help you enjoying life fully, from music to conversations to simply feeling steady on your feet. Take care of them, and they will take care of you. Thank you very much.